Stop blaming your screen for your blurry vision. In clinical medicine, your retina is the sentinel, the early warning system for your entire cardiovascular network. If your eyes are struggling to maintain clarity, your equipment downstairs is likely starving for oxygen, and you're just a few years away from a total system failure. Disclaimer: this content is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician before undertaking any new health protocol. Most men treat male vitality as an isolated mechanical issue. It isn't. It's a hydraulic issue. Your retinal capillaries and your pelvic arteries share the same delicate endothelial lining. Damage to one is a powerful clinical predictor of damage to the other. According to longitudinal studies, men with microvascular retinal damage have a 70% higher risk of developing severe performance decline within 24 to 36 months. You aren't just losing your sight, you're losing your manhood, one capillary at a time. If you want more evidence-based protocols that actually respect your biology, make sure to like this video so we can keep bringing you the hard science instead of generic advice. Think of your circulatory system not as a series of tubes, but as a hierarchy of straws. Your aorta is a garden hose. Your primary flow arteries are standard straws, but your retinal capillaries are the smallest straws in the human body. They are so narrow that red blood cells, which are about 7 micrometers in diameter, often have to line up in single file and even deform their shape just to pass through these microscopic gates. Fluid dynamics dictate that in any pressurized system, the smallest conduits fail first. This is the microvascular canary in the coal mine. When your blood becomes viscous due to vascular sludge from high glucose, elevated triglycerides, or systemic inflammation, it doesn't jam the large pipes first. It jams the retinal network. This manifests as intermittent blurring, a sudden loss of focus, or a foggy visual field that comes and goes. This isn't a lens problem, it's a delivery problem. If oxygen can't reach the photoreceptors in your eyes through these tiny straws, what makes you think it's reaching the deep tissue required for your performance elsewhere? The primary driver here is the endothelial nitric oxide synthase pathway. Nitric oxide is the signaling molecule that commands your blood vessels to dilate. In the eye, nitric oxide regulates intraocular pressure and ensures the macula is bathed in nutrient-rich blood. In the male pelvic region, nitric oxide is the literal on switch for optimal hydraulics. If your body's ability to synthesize nitric oxide is compromised, the first place you'll notice is your vision's inability to sharpen quickly after a transition from dark to light. Clinical research shows that endothelial dysfunction, the inability of your vessels to relax, is a systemic condition. It doesn't happen in one spot. If your eyes feel tired and heavy after only a few minutes of reading, it's often because the micromuscles controlling your lens are suffering from the same lack of blood flow that affects your nocturnal recovery. We are talking about a total body vascular collapse that starts at the periphery and moves inward. Have you noticed floaters, those tiny ghost-like specks drifting across your field of vision? While often dismissed as benign collagen clumps, in a metabolic context, they can represent vascular sludge. When systemic inflammation is present, your blood's rheology changes. It becomes sticky. This stickiness causes microocclusions in the ocular fluid and, more importantly, prevents the rapid blood engorgement required for intimate performance. Imagine your blood trying to flow through a needle while having the consistency of molasses. That is what your heart is fighting against every single second. This creates a state of chronic hypoxia, where your tissues are literally suffocating. This is why many men notice that their vision is worst in the morning or after a high-carb meal, precisely when blood sugar spikes cause the blood to become at its most viscous. Do you wake up with chronically red, bloodshot eyes despite getting 8 hours of sleep? This isn't just fatigue, it's compensatory vasodilation. Your ocular vessels are chronically distended, desperately trying to gasp for oxygen because the blood flow is too sluggish. If your eyes look like a roadmap of inflammation, your pelvic floor is likely suffering from the same chronic hypoxia. Let's do a 5-second check. Look at a white wall or a bright screen right now. Do you see cobwebs, dark spots, or shimmering lights drifting? If you see them, comment yes below. If your vision is clear, comment no. I'll be sharing a link to a free vascular reset guide for the top yes comments in the thread. Understand this: your eyes are the only place in the human body where a doctor can observe live, pulsating blood vessels without cutting you open. They are the window into your bioavailability of oxygen. If the sludge is visible there, it is currently clogging the very mechanism that defines your masculine vitality. This isn't just theory, it is observable medical fact. To fix the smallest straws, we must address the endothelial glycocalyx, the protective, hair-like lining of your blood vessels that keeps blood flowing smoothly. When this lining is damaged by sugar and stress, your blood vessels become leaky and rigid. First, you need a nitric oxide precursor stack. Don't just take generic multivitamins. Clinical protocols often utilize L-Citrulline malate in the range of 6 to 8 grams daily. Unlike L-Arginine, which is mostly broken down in the gut, citrulline has superior bioavailability and bypasses the liver's first-pass metabolism. This ensures a steady spike in nitric oxide levels for hours, clearing the ocular fog and restoring pelvic blood pressure. Second, use an antioxidant shield specifically for microvessels. Studies have shown that microvessel protection typically requires around 100 milligrams of bilberry extract, standardized to 25% anthocyanins. Clinical studies show anthocyanins specifically target retinal capillary strength and prevent the leaking that causes floaters. By reinforcing the eye's microvessels, you are providing the same structural integrity to the vessels required for structural rigidity. Third, you must implement the vascular reset breathing technique to manipulate your blood chemistry. Sit quietly and perform 10 seconds of deep inhalation, 10 seconds of holding that breath, and 10 seconds of forceful, audible exhalation. This temporary carbon dioxide buildup triggers a massive natural nitric oxide release known as the Bohr effect. This physiological hack forces your hemoglobin to drop its oxygen cargo exactly where it's needed most, in the tightest capillaries of your eyes and your extremities. Do this 3 times a day, especially before physical activity. Furthermore, consider your intake of dietary nitrates. Concentrated beet juice or arugula contains inorganic nitrates that the bacteria in your mouth convert into nitric oxide. This is a secondary pathway that works even when your internal enzymes are struggling. Avoid using antiseptic mouthwash as it kills the very bacteria you need to maintain this vital circulation loop. Let's look at the data. A study involving over 3,000 men showed that those with the highest intake of flavonoids, found in berries and dark chocolate, had a significantly lower incidence of both macular degeneration and hydraulic failure. The biological link is undeniable. You are one integrated machine. You cannot have a high-performance engine with clogged fuel lines. If you continue to ignore these visual warnings, you are choosing to let your biological clock run out prematurely. Most men wait until they have a total failure before they seek help. By then, the microvessels have already undergone fibrosis, meaning they've turned into scar tissue. At that point, no amount of blue pills or supplements can fix the structural damage. The time to intervene is when the vision starts to blur. That is your window of opportunity. You are not a victim of aging. You are a victim of poor maintenance. Your blurry vision is a desperate cry for help from your circulatory system. Fix the blood, and you fix the man. Ignoring the sentinel in your eyes is the fastest way to a permanent lights out for your performance. Your body is constantly sending you signals. The question is whether you are intelligent enough to listen. Join the inner circle by subscribing now to master the mechanics of your own biology. We don't do tips, we do protocols. If you've been experiencing both eye strain and a performance dip, tell us how long it's been happening in the comments. We are building a community of men who refuse to settle for mediocrity. And finally, click the link to watch our next video on the testosterone-dopamine axis to see how to wire your brain for total dominance. The journey to total optimization starts with the blood. Take control of your hydraulics today.